There we go. We are now live. This is a meeting of the Health Occupations and Long-Term Care Subcommittee, Subcommittee of the Health and Government Operations Committee, and we have 7 bills on our agenda for today. First bill is House Bill 499, Health Occupations, Private Dental Offices, Infection Control. Bill sponsor is Delegate Bagnall. Lindsay?
As introduced, this bill requires each owner of a private dental office to designate a licensed dentist to be the supervising dentist for the office. A supervising dentist must complete the registration required by the State Board of Dental Examiners and be responsible for all infection control activities within the office. As a supervising dentist may supervise up to 3 private dental offices within close enough proximity to allow for personal oversight of each office as determined by the board and regulation. If a supervising dentist relinquishes their responsibility for infection control activities, the owner of the private dental office must immediately designate an interim supervising dentist until a new supervising dentist registers with the board. I circulated amendments from the sponsor that define infection control activities and remove language that would have limited the number of private dental offices a supervising dentist may supervise.
Delegate Bagnall, if you wish to speak to the amendments, please.
So these amendments were the result of meetings with stakeholders that raised concerns about particularly around the bill being too broad. So we wanted to limit the scope of the bill, clarify that it really that we weren't limiting the number of dental offices that a dentist could oversee, because of concerns particularly about our DSOs and our public health Medicaid dental practices. And I think we're there, but I know we've got some of the stakeholders here who I just want to confirm if there are other concerns that these amendments have not yet addressed.
Are there
we've got board counsel here. We've also got the DSOs, and we've got Mr. Perry from the dentist. So
okay, Mr. Perry, Tim Perry.
I appreciate the chance to be before the subcommittee today, and appreciate Delegate Bagnall's hard work in bringing all the stakeholders together. We had a chance to review the amendment with Danielle Varanian, my co-counsels, and my client, Association of Dental Service Organizations. We have a slight modification that we would like to propose back to Delegate Bagnall. It's intended to be a friendly modification, and we think clarifies and sort of restates current Maryland law as it pertains to liability. I'd hope to have that back to Delegate Bagnall in advance of today's subcommittee meeting. We're just waiting on member sign off, and we'll get that back to Delegate Bagnall very, very quickly. But I want to emphasize that it's intended to be friendly, and we believe it's clarifying as to current law.
Okay, so that would mean, are you acceptable to a whole, Delegate Bagnall?
I am. I just would ask Mr. Chair if it's okay. I know that we have the board and the DSOs here, and if we could just see if there were any other concerns.
Absolutely. Is there anyone else who wishes to speak? Well, let's get the outside groups first. That Delegate Morgan, I'll get to you. The groups that, yes.
So it would be
Edward
Caitlin
Morris.
and Dr. Morris.
Dr. Morris, excuse me.
And hi, Mr. Chair, this is Caitlin McDonough. Sorry, I cannot find the raise hand function right now, but and the amendments make it much better. I think where Mr. Perry's going with the additional amendment, we would be on board as well. So we're just in lockstep with them. Thank you so much.
Thank you. Dr. Morris.
Good morning. I have not had a chance to see any other amendments, but basically what I want to do, this bill is very straightforward. Requires a Maryland licensed dentist to be responsible for ensuring that the CDC inspection guidelines are being followed. Pure and simple. We do not believe, the board does not believe this bill would result in a burden on dental practices. The funeral industry works under the same regulations, and not aware of any untoward consequences of that. Just to give you some background, the CDC publishes a brochure, Summary of Infection Prevention Practices in the Dental Office. And this goes over point by point all the different things that have to be addressed in infection control, tells you what to do and how to do it. If we have inspectors.
And Dr. Morris?
Yes, yes.
Dr. Morris, I just wanted to clarify, we've been working directly with Mr. DeFranco, who is the
Right.
board counsel.
Right.
And he helped us with the
Yes.
amendments.
And I appreciate the efforts that have gone into this. It's true. If the board has receives a complaint, inspectors go to the office, check things out. They have an inspection checklist, which is the same. In addition to that, what I'm trying to show is that well, let me explain. The dentists, when they renew their licenses, every time they renew, they have to take a 2 to 3 hour CE course that covers infection control. So consequently, what they have is information that they have had all their professional life, and they get it repeatedly. The point being that in training someone to take over this supervisory role is quite simple. I think the training is quite minimal. But the purpose of this bill is not to charge people with problems. The board is not interested in prosecuting people. We want to be sure that we can protect the public. To put your mind at ease, the board, in terms of the board's intentions, last
If
summer.
I may, Dr. Morris, you're part of these discussions on the amendments, and if we can, I'd like to move on.
Can I make one
Certainly.
point? The board, just to be clear, the board has introduced regulations that make things easier. It makes it easier for licensees to modify problems, and so we're not interested in prosecuting people. We just want to get things done. But it's a simple problem, simple solution. But it is a problem the board's had, so we want to address it. The board would urge the committee to accept the consensus amendments that have been circulated. But we would request that we restore the provision set forth in the legislation to introduce the limit of number of practices that one dentist can act as a supervising dentist.
Thank you very much.
Okay, thank
Okay.
you. Thank you
we're
for
gonna
your time.
Would everyone silence themselves, please? House Bill 7, that bill is on hold, and Delegate Bagnall, we hope to hear good news from you in the near future.
We're going to keep working.
I know you are. Thank you. House Bill 757, State Board of Physicians.
This is
Supervised medical graduates. Lindsay.
This is an emergency bill that authorizes a supervised medical graduate, which is an individual who has a degree of Doctor of Medicine or Doctor of Osteopathy from an institution that meets specified standards and passed Parts 1 and 2 of the United States Medical Licensing Examination to perform delegated duties in accordance with regulations adopted by the State Board of Physicians under direct supervision. The bill also repeals the September 30th, 2024 termination date of Chapter 445 of 2019, which authorized a licensed physician to delegate duties to a registered cardiovascular invasive specialist. There were amendments from the sponsor that prohibit an individual from practicing as a supervised medical graduate for more than 2 years and alters the definition of direct supervision to require the delegating physician to be in the same medical office as the patient and supervised medical graduate rather than in the presence of, and requires the delegating physician to be immediately available to provide assistance and guidance. This is very similar to a prior bill from last year, with the exception of the termination date for the registered cardiovascular invasive specialists. That bill was House Bill 507 of 2023, and the House vote on that was 137-0.
Is there any discussion?
Mr. Chair,
Yes.
as Bill's, thank you, Mr. Chair, Bill sponsor here. Just wanted to, if I may, Mr. Chair, say that this bill has, as council mentioned, a few very refined updates, amendments that were all agreed to. We had a really productive stakeholder deliberations process, and I think we've got a great product. So I hope that this bill will get a favorable report from the subcommittee. Thank you.
You can, You can
May,
move the
may I
amendment.
move the amendments?
Yes,
I'd like to
please.
move the amendments.
Second.
All those in favor say aye.
Aye.
Is there a motion on the bill as amended?
Motion on the bill is amended.
Second.
Moved and seconded. All those in favor say aye.
Aye.
Is there anyone opposed? It is unanimous.
Thank you. I'd like to thank all the stakeholders for their diligence and input. Thank you, Mr. Chair.
And could I also remind everyone to mute yourselves, please? Thank you. House Bill 759, Advanced Practice Registered Nurses, Delegate Alston's bill. Council.
This bill requires each advanced practice registered nurse practicing in the state to notify a patient in writing if the advanced practice registered nurse does not maintain professional liability insurance coverage, or their professional liability insurance coverage has lapsed for any period of time and has not been renewed. Each APRN practicing in the state who does not maintain professional liability insurance coverage must post the information in a conspicuous location in their place of practice, and the Board of Nursing must develop appropriate language for the required written notification. There are no amendments on this bill. The cross-file Senate Bill 996 passed the Senate 46-0.
Is there any, Delegate Alston, do you wish to say anything?
I'm here to answer any questions that you all have. I think it's a good bill. I hope you pass it.
It's a wise statement. Is there a motion on the bill?
Move
from
the
members
bill.
of the Subcommittee?
Second.
So moved and seconded. All those in favor say aye.
Aye.
Anyone opposed? It is unanimous. House Bill 786, Limited License to Practice Dentistry Services for Adult, Delegate Bagnell, making a return appearance.
Thank
This-
you. Oh, sorry, go ahead, Council.
This bill authorizes the State Board of Dental Examiners to waive specified education requirements for an applicant for a limited license to practice adult in addition to pediatric dentistry. The board may grant a waiver if, in addition to other requirements under current law, the dental director of the federally qualified health center or Maryland qualified health center for which an applicant has contractually agreed to provide at least 2 years of dental services, and the dean of the University of Maryland Dental School requests the waiver from the board and state that circumstances exist to justify granting the waiver. The bill also establishes a pathway for practitioners of adult dentistry who receive a waiver under the bill to receive a general dentistry license. The sponsor has submitted amendments that authorize an applicant to either be a dental fellow or have successfully completed a dental fellowship at another dental school recognized by the board rather than just the University of Maryland Dental School, and removes language that required the dean of the University of Maryland Dental School to request the waiver with the health officer of the public health program.
Delegate Bagnell.
Thank you very much, Mr. Chair. These were consensus amendments that modernize this program and this pathway. Previously, pediatric was the only fellowship available. As we're expanding access and trying to get more providers into our public health space, particularly our federally qualified health centers. This just streamlines the process. It does not change standards or qualifications, but it recognizes that that if we're operating outside of the state of Maryland or outside of the U.S., there's a duplicative effort that's in statute that is not mirrored anywhere else in our health occupations licensure. So I would move the amendments.
Amendments
Second.
moved and seconded. All those in favor of the amendment say aye.
Aye.
Anyone opposed? It is unanimous. Is there a motion on the bill as amended?
Move the bill.
So
Second.
moved and seconded. All those in favor, please say aye.
Aye.
Anyone opposed? It is unanimous. House Bill 874, State Board of Long-Term Care Administrators, requirements for assisted living managers. And
This
the
bill extends the date.
Chair of the committee is the sponsor.
This bill extends the date from October 1st, 2024 to July 1st, 2026, by which individuals must be licensed by the State Board of Long-Term Care Administrators before practicing as an assisted living manager in the state. An assisted living manager employed by an assisted living program that is licensed for 4 or fewer beds must comply with the specified manager training course requirements by June 30th, 2026. There is an amendment from the chair that clarifies the reporting requirements. It's requiring a few more, it's making it a little bit more specific as far as dates for when the board believes they will be able to get the licensure up and running.
Is there debate on the amendments? Is there a motion on the amendments?
Move the amendments.
Second.
They're moved and seconded. All those in favor of the amendments, say aye.
Aye.
Anyone opposed? Is there a motion on the bill as amended?
Move the bill as amended. The bill is amended.
Move the
Second.
bi- all in favor, say aye.
Aye.
Anyone opposed? It is unanimous. House Bill 938. State-owned nursing home deficiencies. Lisa,
This bill requires the department charged with oversight of a state-owned nursing home operated by a contractor to provide notice of a deficiency or enforcement action by a monitoring agency. The bill adds entities to the definition of monitoring agency that may issue deficiencies or enforcement actions. And the bill specifies that notice must be provided to the governor and specified members of the General Assembly within 15 days after a final survey finding and within 30 days after the contractor's final acceptance of a plan of correction or completion of an informal dispute resolution. There is an amendment from Delegate Morgan that would add the local governing body in which the nursing home is located to the entities that are notified in the event of a deficiency or enforcement action.
Delegate Morgan.
Yes, we had some discussion about this at our delegation meeting in St. Mary's County, because really that amendment would only affect two counties. It would be St. Mary's and Carroll County when their new facility was built. I asked that question during the bill hearing. The bill sponsor indicated that he was for it. And it makes a lot of sense to include local government as well, because sometimes local government can actually react a little bit faster and
You're
act a little
freezing.
bit faster out of
Okay.
it, and kind of took the delegation and the General Assembly by surprise. So I don't see any problems with notifying local government as well.
So there is peace and harmony in Southern Maryland?
If you go back to the original problem where we had this abuse, I hope so.
Move the amendment.
The amendment is
Second.
moved and seconded. All those in favor of the amendment say aye. Anyone
Aye.
opposed? It is unanimous. Is there a motion on the bill as amended?
Move the bill as
Move the
amended.
bill. Second.
Second, there are no fees involved here, right?
I don't believe there's any fees.
Can I amend a fee onto this one? please?
Okay, the bill it was unanimous. Okay. Final bill, House Bill 1103, Miriam Kelty Aging and Senior Social Connection Hub and Spoke Pilot Program. Delegate Wallach.
Delegate Bandari has his hand.
Yes, Delegate Bandari.
No, go ahead. Just
Oh,
read the
okay.
bill. Yeah.
So House Bill 1103 establishes the Miriam Kelty Aging and Senior Social Connection Hub and Spoke Pilot Program in the Maryland Department of Aging. The goal of the pilot program is to support villages that seek to take advantage of operational proficiencies in existing systems, knowledge, skills, and resources to expand services to more residents in the geographic region. The Department of Aging must select the Montgomery County Village Consortium to implement the pilot program for 3 years. And in fiscal 2026 through 2028, there will be an appropriation of $80,000 for the pilot program. There is an amendment that was distributed. It's in Delegate Rosenberg's name. It was suggested that it might be needed in the written testimony, and it specifies that the Department of Aging will transfer the appropriation, the $80,000 each year, to the Montgomery County Village Consortium. I heard back from the sponsor. She's okay with it, but she also doesn't really think it's necessary. So The will of the subcommittee.
Delegate Wallach, do you want to speak to the amendment and or the bill?
Yeah, good morning. I'm happy to take any questions you may have about the bill, but essentially, we're trying to test out this hub and spoke model where multiple villages can get together and leverage their resources centrally so that financial management, logistics, and other elements can be handled centrally so that the 7 hubs can actually do what they want to do, which is support seniors aging in place through services and through social events and the like. We're testing out this model in the hope that we will learn from it, because at the end of it, again, the consortium will provide a best practices report for the state so that this model can be implemented statewide. The amendment it's a friendly amendment. It's essentially just asking to ensure that the monies actually flow to the consortium. I have no issue with it. I also like as Lisa mentioned, I don't know if it's necessary, but I'll leave that to the committee to determine.
Delegate Bandari.
Thank you. Yeah, this is a great bill that centralizes administrative tax and fostering collaboration among villages. This is the first pilot program, and this is wonderful bill. So, I mean, regarding the amendment, delegate says she doesn't have any concern. I would like to move the amendment in the bill.
The amendment is moved. Is it seconded?
I thought we already seconded, but yes, I'll second.
Okay, amendment is second. Is there discussion on the amendment? All those, Delegate Bagnall.
It's just a little thing, but it's a technical thing that Montgomery spelled wrong.
Sorry about that. I did it late last night.
Sharp Eyes Award goes to Delegate
Correct.
Bagnall. Well done. On the amendment, all those in favor say aye. All
Aye.
those on the revised amendment. All those in
Aye.
favor say aye. Is there anyone opposed? No, none opposed. Motion on the bill is amended.
Move the bill.
Second.
Moved. All those in favor say aye.
Aye.
Aye. Okay, we are done. And for those of you who are not on the acquisition of nursing homes subcommittee or work group, you are free, so far as I know, for the next hour until the full committee meets at 11. Thank you all very much. Okay, you should sit in there. Okay. I don't think I'm just this. I'm not a roster. Yeah. Oh, okay. This one's that was going. That's it. Well, why don't you send it to the answer. Yes. Hopefully we weren't being televised.